What I can do to perfect my patients' smiles is so much more precise than what I could do without SureSmile.
There's no question in my mind that SureSmile is the way to go. I mean, there's just no way you can treat a case safer or faster.
South Texas Orthodontics is a leader in the field of orthodontics. It's a specialty that has evolved from
bands to brackets, from splints to ligatures to shaped memory wires. But now, for the first time, he, like other SureSmile orthodontists, has a tool to move teeth not just effectively, but to a precision of 1/10 of a millimeter and 1 degree of rotation or torque in any plane of space. It's a paradigm shift in orthodontics, and it's called SureSmile. What is SureSmile? SureSmile is a revolutionary technology that combines 3D imaging and digital modeling, treatment planning software, and robotically bent arch wires with, for the first time, the ability to see bone.
Knowing the anatomy of the bone versus the roots, it makes all the difference in the world because we're used to looking at just x-rays in 2D.
I think that it's very important for the general dentist population to be aware of what's possible today with the advent of implants and things like that. Getting roots parallel between adjacent teeth and getting enough room for implants and those type of things is critical.
This enables the orthodontist to deliver precise tooth movement, better outcome quality, and less time in treatment for patients. How does SureSmile work? With advanced imaging, the orthodontist takes detailed pictures of a patient's face, smile, mouth, and teeth. The computer-generated images are transformed into a 3D model, enabling them to place the teeth in the optimum occlusion with the best facial and smile results. In conventional treatment, an orthodontist bends wire with pliers to guide the teeth into position. But with SureSmile, using the doctor's prescription, a robot bends and customizes the arch wire for the patient. All the bends to move the teeth are programmed into the wire. When placed in the patient's mouth, their body temperature activates the bends and the wires move the teeth towards the desired finishing position. Teeth don't move faster with SureSmile, they move more efficiently. And because there are fewer wire changes with SureSmile, patients experience less discomfort and they require fewer visits. SureSmile Precision cuts the treatment time by 1/3 compared to traditional orthodontics, which means patients get out of their braces 8 months earlier on average, and less time in braces reduces the chances of decalcification and other problems that come with longer treatment. Most importantly, the planning and precision features of the SureSmile technology enable the orthodontist to consistently maximize occlusion and facial aesthetics. The technology's precision allows him to create the optimum: functional occlusion, smile line, cuspid rise, and incisal guidance with maximum interdigitation of all the teeth. And now, with SureSmile, the orthodontist can collaborate virtually with the dentist in the comfort of their own office, online with SureSmile's 3D imaging. Precision spacing for patients' crowns, veneers, and bridges is now possible to within 1/10 of a millimeter. And SureSmile's Precision 3D software makes placing an implant accurate. An independent study published in the World Journal of Orthodontics concludes that the SureSmile process results in superior ABO quality scores with reduced treatment time when compared to similar patients treated by the same practitioners with conventional appliances. SureSmile believes in evidence-based results and has compiled a vast database of documented finishes that increases every month.
In addition to providing SureSmile, South Texas Orthodontics also offers incognito or lingual braces, 3D imaging, and Invisalign.
Before, when I was wire bending, the patients would come in, we'd get to that finishing stage, I'd take a wire out, I'd put a bend in it, I'd seat it, I'd send them on their way, they'd come back in 4 to 6 weeks, I'd put another bend in their wire, they would leave, they'd come back in 4 to 6 weeks, I'd put another bend in the wire, because a lot of the bends that we're doing is a little bit of guesswork. So I would send them on their way, see how the teeth reacted to those bends, and then make accommodations for that. With SureSmile, I create all of those bends in one wire by moving the teeth virtually on the computer. Then a robot captures that image and creates a wire to take the teeth directly there.
With SureSmile, we can get out of braces a whole lot faster than we could in the past.
There's no question in my mind, that SureSmile is the way to go. I mean, there's just no way you can treat a case safer or faster.